Hi everyone, this is Dr. Mark Riggs with 5280 Functional Medicine, and this presentation is all about vitamin C. So first I'd like to explain what exactly a vitamin is. Vitamins are organic, carbon-containing compounds that are essential in small amounts for various metabolic processes. And while they do not provide us with energy, they enable the body to utilize energy from fats, carbohydrates, and proteins. Also, in megadoses, vitamins can be toxic or result in adverse effects. Some common terminology when discussing vitamins include avitaminosis, hypervitaminosis, and vitamin supplement. Avitaminosis means without vitamins. Hypervitaminosis is a condition caused by ingestion of excess vitamins, and a vitamin supplement is just a concentrated form of vitamins. The functions of vitamin C are many. As I mentioned, they're involved in various metabolic processes throughout the body. Vitamin C has an antioxidant effect. It's involved in immune system function, required for our stress response, needed for collagen formation, and it aids in the absorption of non-heme iron. Vitamin C also protects us from cardiovascular disease and several cancers. Vitamin C is also required for this conversion of dopamine to norepinephrine, the production of serotonin and corticosteroid hormones, the conversion of cholesterol to bile acids, and the production of hormones including antidiuretic hormone, oxytocin, gastrin, cholecystokinin, thyroid-stimulating hormone, and calcitonin. One thing many people don't understand is that vitamin C is essential. We have to obtain it from the diet. Whereas many mammals and many animals can produce vitamin C from glucose, humans and other primates lack the specific enzyme needed to convert glucose to produce vitamin C. Most resources recognize that greater than 2,000 milligrams of vitamin C at once is too much and can cause abdominal pain and osmotic diarrhea, whereas too little vitamin C is generally recognized as less than 75 milligrams per day for the average female and less than 90 milligrams per day for the average male. And in functional medicine circles, we tend to advise our patients to take about 500 milligrams 3 times a day to 500 milligrams 6 times a day for optimal vitamin C levels. However, stress and cigarette smoking may increase that need. Here are some of the best food sources for vitamin D, and as you'll notice, green leafy vegetables and citrus fruits are some of the best sources, and other fruits and vegetables are listed here below. The absorption of vitamin C takes place throughout the entire small intestine. It's transported through the blood freely as ascorbate, which you'll notice on many vitamin C supplements at the store. 500 milligrams per day every day has been documented to saturate the blood and maximize both tissue and plasma concentrations under normal conditions. And as I mentioned, some of the abnormal conditions would be chronic stress or cigarette smoking. That being said, intravenous vitamin C will allow for far higher plasma concentrations of vitamin C because intravenously we can bypass the gastrointestinal tract and avoid the gastrointestinal irritation that we would get with greater than 2,000 milligrams of vitamin C at once. Sometimes intravenously we can do as much as 10,000 milligrams or even more of vitamin C. Vitamin C is related to bone disease because vitamin C is a necessary cofactor for collagen production, and collagen is the main protein involved in all of the connective tissues in our body, including bones, tendons, ligaments, cartilage, teeth, skin, hair, and nails, eyes, and blood vessels. There's a connection between vitamin C and cardiovascular disease. One component of that is that vitamin C is required for carnitine synthesis, and carnitine is responsible for transporting long-chain fatty acids into the mitochondria of our cells to be used for energy. There's also an inverse association that's been established between plasma vitamin C concentrations and our risk for cardiovascular disease. As we take more and as our plasma concentrations go up, our cardiovascular risk factors drop. Vitamin C supplementation also has been shown to mildly decrease total serum cholesterol, oxidized LDL, blood pressure, and mildly increase HDL, although the mechanisms for these changes are somewhat unknown. Vitamin C is also inversely associated with several cancers, including oral cancer, pharyngeal cancer, esophageal, and stomach cancers. It is a water-soluble antioxidant, allowing better detoxification of carcinogens, and in fact, it's been illustrated that 1 gram of vitamin C, when ingested with nitrates and nitrites, commonly found in smoked cured meats, help prevent the formation of carcinogenic nitrosamines and protect the upper GI tract from cancer cell formation. This is part of the reason why we should avoid eating meat alone, and we should always be adding veggies when we eat meat. Vitamin C has a significant antioxidant effect. It directly scavenges free radicals, but it also assists white blood cells by increasing their activity. It enhances the synthesis of immunoglobulins and regenerates the antioxidant form of vitamin E. Vitamin C also regulates gene transcription for collagen, elastin, and the liver detoxification family of enzymes, the cytochrome P450s. Vitamin C also increases the expression of anti-cancer apoptotic genes. Apoptosis is a process in the body of regulated cell death. This is a subject that's been under lots of scrutiny over the years, the association between vitamin C supplementation and the common cold. And there was a study done in 2010 that analyzed nearly 24 other scientific studies of the development of the cold while on vitamin C therapy, and this Cochrane collaboration study concluded that vitamin C is not preventative. It is, however, able to decrease the severity and the duration of the common cold. Whereas the average duration of the common cold is about 12 days, those on vitamin C therapy saw a reduction of 4 days. It also helps alleviate some of the symptoms of the common cold by increasing cytokine production and destroying histamine. Vitamin C is found primarily in the pituitary and adrenal glands. And this is because vitamin C participates in the production of both aldosterone and cortisol that are produced by the adrenal glands under times of stress. Vitamin C is not without interactions and some adverse effects. I already mentioned GI irritation, gastrointestinal irritation. One positive interaction is that vitamin C enhances the intestinal absorption of non-heme iron, so this is good for patients with iron deficiency anemia. This would not be good for patients with a condition known as hemochromatosis, otherwise known as iron overload. Also, supplementing with greater than 600 milligrams of vitamin C at once has been shown to decrease our absorption of copper, which is, for example, one of the several cofactors involved in thyroid hormone conversion from inactive thyroid hormone to active thyroid hormone. Some more serious adverse effects occur in genetically susceptible individuals, one of which involves kidney stones, because 2% of vitamin C is converted into oxalate, so those predisposed to calcium oxalate kidney stones should avoid doses of vitamin C greater than 500 milligrams. Additionally, vitamin C competitively inhibits the kidney's absorption of uric acid, so those predisposed to uric acid kidney stones or gout should avoid vitamin C doses greater than 1,000 milligrams at a time. Vitamin C is unsafe for anyone with conditions known as thalassemia, which is sort of like the opposite of anemia, where we have too many red blood cells. Sideroblastic anemia, where we have enough iron available, but our body is just unable to incorporate that iron into our hemoglobin. And as I mentioned before, hemochromatosis or iron overload. Well, hopefully that was everything you ever wanted to know about vitamin C. This is Dr. Mark Riggs with 5280 Functional Medicine. Please feel free to explore the rest of our educational talks at www.5280functionalmed.com. And if you enjoy them, we'd appreciate it if you'd like them and share them with your friends. Thanks for listening.